the second season, like we said. In the second season, as we call it, of our analytical community. Today, you must have seen the agenda already, but I can share what we are going to be doing today. This space, as you know, was thought as a platform of co-creation. It is a meeting where we can produce and we can have dialogues that will allow us to exchange experiences, data, actions, strategic actions, best practices in terms of care. And that is what we are going to be doing since and have been doing since last year and throughout this year. Initially, we said that we were interested in assessing the institutions, the community, civil society, and private sector in terms of care and the system. However, the analysis of 2023 actually focused on institutions mainly. That was a de facto change, a decision that we decided in our dialogue. I think it's very important considering the following steps and also how we are going to be involving different dimensions. But I think that there was a specific focus on institutions and what is happening there. Then, also from the beginning of our analytical community, the idea was to bring the practice according to the institutions that we were in, and then to give back to those same institutions. And in today's session, the closing session, we are going to be continuing seeing and walking that way, and is going to be focused and channeled into a report that we are going to be presenting at the beginning of next year about what has been happening in this community, what has been happening with this exchange of experiences and best practices that we have been having. This systematization, this analytical analysis that we have been doing and that we are going to be starting to organize today, because it's something that we are going to be doing between all of us. We wanted to inspire those decision makers, decision maker individuals, and also the objective, and we can all agree, I believe, is to place care on public agendas and also start working on that very well. Unlike different communities, in 2023, you might remember that we focused mainly in making the right to care effective. And we discussed what we were doing in that area, what are the obstacles and the strategies. And that's why the focus in the last meetings has not been on assessing the concepts of right to care, but on how to achieve it. That is the real practices in terms of institutions and policy in general. However, and I think that we can continue talking about that, the question of what does it mean? What does care mean? And the policies around it. I think those questions continue to be something that we need to conceptualize, and it continues to be in our dialogues and conversations about how are we going to be operating with that right in mind. And at the beginning of the year, we have also thought more profoundly in the context of Latin America and Caribbean in relation to what we did last year. And we worked in different regions of the world. And we did that through the conversation on the specific cases that we brought to this community, to this analytical community, not with the intention of understanding these cases as an example, but as an example that will foster more conversation. that will be an incentive to this. And one of the most interesting characteristics of Latin America and the Caribbean is to be able to have um, an education and more policies about care. I'm talking about work and also as a right. And by seeing once more in the analytical community that focus on Latin America and the Caribbean. Also, when we imagine this space, we wanted to we wanted to see the limits and the ideas and not go deeper because we wanted to see of everything related to care in the problematics, explicit and implicit, that continue to exist. And we also wanted to focus on the operations through analyzing the cases that we have been working on and maybe think about potential solutions while sharing these experiences that as we have been doing so. So the focus on this community has not been exactly to systematize agreements which exist, that we have, that we can share, but we have been wanting to identify the challenges, the contradictions, and explore what are the strategic paths in each of our countries and region-wise, just to continue working on that. We have not always been successful, and we are going to be continue discussing that, I believe, while sharing experiences, but that was the foundation of this space. And you might remember the objective that as was established originally for this community and that we shared in each of our sessions was to identify the advancements, the progress, the challenges, obstacles, the gaps that are in the recognition and exercise of the right to care in Latin America and Caribbean from the analysis of national and subnational cases in which we focused considering 4 points, which are the norms, legal implementation, strategic actions, administrative and others, and fourth, the public policies. With that objective in mind, what we wanted to do was to share the keys of working on this, what are the interpretative frameworks in the region, and also the communications that could be used or have been used in the institutions focused on women and feminist organizations, and how are we going to align the right to care with other rights, understanding understanding this in the realm of public policy. A lot has happened since we started this community. And at the beginning of the creation of this space in this year, in July 2023, the UN established that on 29th of October is going to be the International Day for Care. And last October, the UN sent the first resolution on the lever of care from the perspective of human rights. And a lot of political processes have happened regional wise, including the request of Argentina about the content and the scope of the right to care and in relation to other rights. And this community has to be understood as well as part of that network, of that debate, political debate. And a lot has happened this year, and it has to do also with the type of debates and conversations we have had and will continue to share. Laura is going to go deeper on these processes that have been more visible this year and what is and where we are right now. And that is not only the context in which we have been discussing this, but it's also the result of the sort of debates that we have had. It's the result of the work, the space of the people who are here, the institutions that they are representing, also the efforts that are converging in spaces such as this one, within the political sphere, in the institutions, and other places. So what we are going to do in today's session, I want to welcome you once more, is to have a very general first approach and a very precarious approach of trying to systematize the debates, the very rich debates that we have had during these months, and maybe we can share that. Then we are going to be hearing to Laura, and I also want to welcome all those speakers, and then we're going to have a debate with all the people in the group. So if you're okay with this, I will continue, and we are going to see the results of these discussions, of these debates. We're going to be seeing the report that we are going to be working on, and that we are going to be presenting a joint report that we will presenting next week. And Laura is sharing a screen, and it's just a guide for the conversation. So a revision of the type of debates that we have had that lead first to report, and we have been debating on this, but to report of the very, all the movement that this has been having in the legal framework, in the legal context, and in many countries, but specifically those that we have been focusing on in this analytical community, continue to work to constitutionalize the right to care, even though it has been recognized in different countries and at different levels. So mobilization, legal mobilization means the efforts to make it care explicit and to recognize and protect this knowledge. And this has been part of the debate. And also the idea of making it part, making it more formal, more legal. It is part of the goal to make it to be something recognized at an institutional level. We have also discussed the case of Argentina, that they wanted to make it explicit, the right for care, the right to care, and also we discussed the process in Chile, and they said that we talked about the exes and the Costa Rica case, for example. You might remember that we were working specifically on what is happening in Costa Rica in this we sphere. We mentioned one of the strategies that has to do with reforming the constitution to recognize the right to care and also the right for to care for the caretakers. And we talked about the foundation, that it has to come from institutions, the basis, and we also talked about Mexico and the reform in the constitution at a really high spheres in the republic. So the goal was to make it part of the institutions, and that was part of the movement that we did, the mobilization that we did in legal frameworks, in the legal sphere, to at least part of the countries on which we were working on. But the legal mobilization is not only in the constitution, but there is a fight to create regulations. So, for example, to create institutions and policies in relation to care. What are these debates showing? Well, in the region, there are different routes, different norms, different legal frameworks. We have the case of Chile, for example, in which on January of 2023, it was a decree signed by the President of the Republic because of a national policy that was focused on a comprehensive care. And also in Colombia, for example, they were talking about a national system for care, and there was a new law this year. We have Peru's case, where the 5 bills are being discussed, as was mentioned in the last meeting. And three of those bills recognize the right to care and the need of a creation of a care system. The case of Cuba, for example, the legal framework is a very important, it's a very important thing in Cuba. And there is the need that this reaches coherence and achieves a level and a status of institution. And in 2021, for example, there was a decree that recognized care as something essential for human beings. So what I want to make clear is that in general, we have a legal mobilist movement that is not stopping in terms of rights and norms and laws in relation to right to care, and just we want it to be recognized explicitly, and in, even though that it is recognized implicitly, but we want it to be recognized in institutions, and then a production and a creation of bills, we want them to become laws and decrees, among others, that are recognizing explicitly the right to care. So that was more or less the nature of our conversations. And on a second place, I think that it is very important, and I think that's one of the most valuable things coming from our community was to shed light on the fact that there is a horizon to achieve comprehensive systems of care. But we are taking different paths towards that. And what would be great is to assess each of the routes that we have been taking and to see if we can reach that goal. And in 2022, for example, it was evident that the aim of creating comprehensive care systems was the goal in Latin America. It's something that it was the standard, not in other regions of the world that have different horizons in terms of operations, in terms of care. And on that, we went back in this year and we went beyond that, and we discussed how we're going to do that. And then there is a great diversity in the forms and the ways in which we are trying to achieve it. And when we are analyzing Argentina's case, for example, we realized that there was a work from institutions which was very strong, and from there they started to working on bills, and they made consultations with different parties. I am going to be talking about that. And while the plebiscite is coming, they are making some progress. In the case of Chile, which are still in the design phase, as we discussed, we created the creation of the system in the programs of the government through a council that is going to be interministerial. In the case of Colombia, the thing was very different. The initiative was intersectorial with different parties and tried to reincite in the government's plans with the current government. And from there, we decided to talk about governance and also when that plan is going to take place. In the case of Dominican Republic, we also managed to achieve a commitment from the government, which is to create a national system of care with laws integrated to it. And we also gather different institutions and organizations. In Mexico's case, it was created a national system in the 32 states of Mexico, and there is a possibility of creating systems at a local level for care. So the horizon of creation of comprehensive care systems in different countries of the world, of the region, are trying to achieve this in different ways. And it means a different training at an institutional level, which would be very important to go deeper into that because there are different experiences to be shared in each institution. And at the same time, there is not one way of achieving that in terms of norms and laws. Sometimes we are working on public policies and then we will achieve laws, and then the other way around. We want norms to become institutions. And so the different routes needs to be part of the debate to assess in terms of what we have learned, the lessons learned, and the scope of those efforts. And so in general, it's something that we can see in our analytic community, and ultimately that we have different institutions as well. So first, it is quite obvious, but we have to continue saying this, that we need to create institutions in the matter of care, which is still something that we need. We need more institutions, and that is a way of protecting the right to care and also guaranteeing that right. But it's also to shed light that these institutions are very different. While in Argentina, we have for example, the Ministry of Women, Gender and Diversity. In the case of Chile, for example, we have the council, for example, between interministerial. In the case of Colombia, which is also very important in an intersectorial effort, and in Costa Rica is a different thing. So what I mean is that we have to assess, examine very at a deeper level institutions, and that is going to provide learning and knowledge, both in the countries where they are trying to create their institutions for a national care system. Maybe they are at different points. Maybe they are one step behind. Maybe they have made more progress. And another point that was very much discussed this year had to do with the need of providing as assessments in relation to the tools and strategies that we actually have. We have not discussed this on a deeper level, but it is very important because we have said many things that there is a deficit of information in terms of what are the public policies that are current and the services that we have. So the creation of maps, for example, the care map in Argentina, and the one that they shared in Chile, and the MACO, the Mexican care map, are examples of not only of data and analysis, but also they are a tool for citizens, and they are pushing towards public creation, and it's a step that we have to take. We cannot skip it. And it's something that the community has really highlighted. Another point that I believe was very interesting in the dialogues that we had this year had to do with how the need of having comprehensive care systems have to be conceived in a territory. So there are cases in which some people, for example, in Argentina and Chile, insisted on very specific points, for example, and we were discussing this because they wanted to focus on the production of policies or creating a policy framework or bills required a specific step, like I mentioned, that the rest of the countries cannot skip, that we need to have a dialogue in our territory, in our country, in the case of those countries, but also in other countries, as we have discussed, the dialogues in both countries that are highlighting the need of not producing policies without doing a process at a grassroots level, to having those communications, those dialogues with the community. On the other hand, something else that had also been mentioned in the analytical community, but that came out again, had to do with the attention that has to do with the universalization and working with priority groups. So we still continue to establish priority groups in the construction of policies, and that is a data, that's an information, that's a fact. And we don't necessarily talk about the implications of doing that. So some of the cases in which we were analyzing and focusing this year and that we can discuss and include in the report has to do with this focus. It's a fact that we will continue to work and that we are working on the priority groups, but the right to care is a universal right. So how are we going to be establishing that in terms of operations and in terms of law? And another topic which we have discussed many times, but we have to include it, has to do with the financing part. And in all the cases that we discussed, we also mentioned that the biggest challenge was the economic situation. How are we going to be establishing those, anything, any program, any project, any bill financially? How are you going to be paying for it? And that is a constant question at the same time that from it we we derive different topics. For example, why is it focusing on this specific on the financing with this sort of policies when it is not the case with different policies? The financial part is not essential for other policies. So of course we have to create a financing structure, of course, but the why the economic factor is an excuse to make progress on the creation of these bills, of the care bills. Now, another point, and just to wrap up, that curiously emerged in our debates this year had to do with how, even though it is a very visible and important topic internationally, at the UN, regionally, I'm talking about a discussion in relation to care and the legal framework and the actions, and it is so present in our region. It is a very discussed topic, but that is contrasting with how many people in the countries in which we were working for identify as a deficit of of a of a demand from citizens. So in all countries, even in those where the discussion has made a lot of progress, they continue to say that there is no movement from the citizens, that we require more mobilization, we require raising awareness, we require action from citizens. So for example, in Costa Rica, we said that we require the movement and participation of citizens. For example, childcare, but in childcare there was some movement, but not in other fields of care. So the idea of citizens participating is contrasting with the visibility of the topic in the regional agenda at an international level. And that is an area in which you should focus more. How are we going to increase citizen participation and how we are developing these debates? And at the at the beginning of the creation of this community, we highlighted on the actors, on the parties, and the challenges, the obstacles from the bills and the policies in matter of cares. Not always, um, we could not always go deeper, but we did have a landscape, and that landscape allowed us to identify four potential answers to the question, who are resisting or which are the obstacles? And one of the potential answers, there are no parties that are resisting, that are becoming an obstacle per se. A second answer has to do with something that I mentioned before. What are they resisting against? And maybe we should have a very general tag of a neoliberal explanation, maybe the impossibility of financing these projects or the problematic of obtaining financial resources. So maybe what they are saying at different levels of the government and the excuses that they give for the financial deficit. And so those might be resistance or obstacles. And a third type of obstacle that was mentioned, and I am going to be mentioning in a couple of moments, and maybe be more precise, has to do with actors that are more on the conservative side that are trivializing the care agenda or are only focused on the maternity side of these policies and maybe having some regressions in the field. And a fourth type of obstacle identified had to do with an obstacle that comes from the groups that are fighting for this. So, for example, in Argentina, they said every group that is working towards this, that have specific populations, is producing obstacles to having a comprehensive care system because childcare, for example, there are some sectors that want to prioritize the women and not the children, and they have a problem with that, or they mentioned that. So the same groups that are working towards care are setting their own agendas and trying to prioritize their own groups and providing different arguments, and so that might be an obstacle. I think those four answers should be analyzed at a deeper level. And maybe if one of the answers is no one is an there are no obstacles, so there are no actors that represent obstacles, well, maybe we should analyze that a little bit more. And with this analytical community in 2023 can focus on that. And with this, I am going to wrap up. In terms of challenges, we identified many challenges. We repeated many challenges that are very known to us. I am going to repeat one of the most important challenges. And I am going to say it really quickly, one of the most important ones, the challenges of institutions, creation of institutions. We do require institutions in this to progress because it does seem that the aim is to change the policies, but that does not mean that the institution is going to change. The idea of making progress in terms of the conservative field, the challenge of the deficit of information, including the people who are involved, the deficit of the offer that has to do with services, for example, the fragmentation of the services, the publicity of some services, etc. The challenge that has to do with political forms to talk about monetization, for example, in Chile, you might remember that has to do with the pay for caretakers because there are not enough incentives for them. So how to translate that into a paid work, a compensation per se? There is another challenge, which is to where are we going to focus in specific priority groups or the universalization of right. A very important challenge has to do with the need of creating quality standards in the services, in the type of job that we are offering, in public policies related to care, the challenges that had to do with what does it mean in this market? How is the market going to be involved in this and participating in this, the private sector, for example, in this space? We have not discussed and not reflected on what does it mean care in terms of the environment. and that was not analyzed enough, I believe, in our discussions. And also, it was mentioned, but we need to go deeper on what does it mean care in the community and the forms. It was mentioned in some of the sessions, but we did not discuss it further. And the need to create strategies, especially in different timelines. And education, another challenge had to do with self-care. How are we going to be putting self-care on the table in the debate, in the political debate? A greater challenge has to do with how we are going to talk about the lack of alignment between the policies that take care of care. So the process towards we are trying to go has to do with that. Something that came that was very interesting and that could be a challenge as well has to do with the importance of analyzing not only public policies at a national level, but also subnational level, because sometimes we see that there is a window of opportunity to think of in an innovative way in terms of policy creation and institution creation. The biggest challenge depends on the stagnation of the process of mobilization in terms of the policies and institutions. Also has to do with a lack of compliance. At the beginning of this analytic community in 2023, we said that we were going to go back to those open questions. And what we are trying to do today at the closing of this last meeting is to continue working on those questions. There is a list. I made a list quite quickly, and maybe we can go deeper on those questions and in the report. But the idea of how are we going to be answering those open questions and what is the progress that we are doing, maybe that is the biggest focus on this. And I want to just close by saying that there is something quite important that has not been worked as profoundly as we should, that has to do with the potential and the reality. There, we might go back and we we might not continue advancing because there are different political realities throughout the region. There are a lot of movements that are against rights in our countries. And for example, in Argentina, we're grieving the result that we saw in the presidential election. And so we have to face the importance of discussing how political change in general, not only in terms of care, can or will need revisions in the fight for care, and what does a democratic agenda has to do with the political problems, with the conservatives, with the neoconservatives, how it's going to be integrating to the progress or progressives, if they are providing some results or no, or to the demand of care, and what does it mean to the environment and to make the right to care effective. And the idea of being willing to work on the creation of spaces such as this one. So it's something that we want to focus on that. I'm going to stop here and I want to give the floor to Laura. You have the floor, Laura.
Bueno, muchísimas gracias,
Thank you very
Eileen.
much, Eileen. It was very clear. I think it was a great summary of the 2 seasons of our analytical community, our care community. We are very proud of this community. I wanted to mention basically the leader of our dear Elisa, who's going to be joining in a couple of moments. But without her support, without her ideas, her clarity, and with the support of the foundation and all the lines, all the organizations associated to it, the Global Alliance for Care has been fundamental. I also wanted to thank especially all the staff of the Friedrich Ebert Foundation because they provided interpreters, especially in the first season. So the idea of having an interregional dialogue was very great. And each of the speakers, the presenters of their specific cases, the countries, and also in that great summary that Eileen made allowed us to reach this point. I am going to be very brief because Eileen really did discuss all of the topics, and I do want to hear from our speakers that are going to be speaking today. And I just wanted to mention once more the objectives, the starting point, and where we are today, which is not really it's not really an objective. Of course, this is human rights and it's a gender issue. It's always a starting point of sorts. So in these two seasons, what these two seasons shown was it allowed us to strengthen some of the points that we wanted to synthesize. The first has to do with the construction of care as a human right. Of course, people in general had an idea of what this construction was, of this idea of the creation of care, of being cared for, of caring for others, of self-care, these relationships between families that has always been um, guided by the civil society, by families, that was always regulated with a very specific gender issues, discrimination issues, but some of them had an idea, a first idea. And of course, in the 20th century, there was a feminist demand that was very clear in terms of democratizing the civil framework in terms of care. And for example, in many countries of the region, in the Caribbean, the custody, for example, the parental authority is placed on males. But I think that it's good to see the biases and for example, Eileen was making it very clear that we have not had a lot of citizen participation. And so there is a need where the response in terms of the laws are not including women, are not contemplating women. It is something that supposedly the laws and norms and policies were providing in terms of the rights for women. But that bias, that gender issue was very clear. And then we saw it in terms of labor. There was a lack of women in the workforce that was paid with compensation. And it was at the end of last year, we're talking about the 80s, are also signaling that work was focused on men. But we also have a different exercise that is very different. So women have achieved to be women laborers that get paid. And this is important because the benefits of having a job that is paid usually came from the husband who used to be the worker. And we saw that. So, regards this recognition of rights as a human right that was reached after the consensus region-wise, which was the one that took place in the consensus in Latin America and the Caribbean, and the right to receive care, to take care, and for self-care. And the region gave a very important jump conceptually of expressing it in such clear terms in the international meeting of the elderly. That was a recognition. It doesn't mean, I don't mean to say that it was implicit. No, it was very clear, but we were not designing it as care. So civil rights, labor rights, and the right for care. And I just mentioned this. And I am sorry for this comparison, but I live in Argentina. I am Argentinian, and we are living very horrible times, very dark times. So the idea of exercising our rights is a construction, it's an architecture. That's why we have highlighted in this community not only the universalization of the right to care, and Eileen mentioned this. This was established throughout some of the expositions that we had. Some of our speakers mentioned this, and a focus between answering between this universalization and having some limitations at the time of establishing public policies. And so this is going to continue to be attention for many years, but should stop being something that is creating attention. It should be a universal right. So once we have taken care of the priority groups, then we will move forward towards the universalization. But, and I want to summarize this first part in terms of the right, we do need that citizen participation, that empowering of the citizens. But also we're including Marta Lama's concept of emancipation because we need that. And that is the critical point. So a priori, we are still missing a step. There is a very, very important step because we have to get rid of the bias, of the gender bias, and because our right as humans should not reproduce those gender bias in the institutions, for example. And that you also mentioned, for example, those who belong to the executive branch, but also those who belong to the community that has to do with the legal framework. And it was great to have your perspective, but we don't want the gender bias to be reproduced in those areas. So that is what is going to bring social change, real social change. But a couple of years ago, we commemorated the International Day against the violence for violence against women. That cannot happen without critical and essential parties, and men are essential towards this progress to make some advancement. We should not think that we are facing a vulnerability of redefining. No, we have to distribute it and redistribute it between all the actors and all the parties. And the following point, and now we'll finish with that. But Eileen mentioned a turning point that had to do with legal frameworks, legal mechanisms, the mobilization that was defined. And it was this idea between recognizing care as a human right that made it possible so that the states should take some commitments. And we have worked so hard to change that rhetoric in which we were talking about the challenges that were so obscure because we wanted states to be fully committed of the requirements and the needs and what they had to do in terms of the policies and the responsibilities in other countries. And that legal mobilization is opening towards a third party, which is the judicial branch. We are at a very important point in terms of interpretation in the region. On the one hand, we have a survey coming from the government of Argentina. It had to do with an alliance with the government of Mexico, initially in other areas, in the field of the UN, for example, and it had to do with the International Day for Care, but the Inter-American Court started a very important thing. Argentina is requesting to the court that they should expand the scope of the word care, that they should include taking care of others, being cared by others, self-care. and that is what we were trying to talk with them, and that is a very important challenge. We still don't have the information of how many documents we will have. That is the academia, different organization, the civil society, most of us who are here, we have been involved in that activism with the judiciary branch. And that is a very important step. It has strengthened alliances, it has strengthening groups, positioning groups, and a very important part of being part of this group. I think that is a very important information. Next year, I don't know if we will have a new season, but the truth is that from this community, we are stronger so that we can achieve this result. And in a scenario where we are thinking that the Inter-American Court of Human Rights is going to expand on this concept and to set the interdependencies with other rights. But there is another scenario in a judiciary field, which is the concrete steps that are taking place in different courts. A few weeks ago, for example, the Supreme Court in Mexico, in the room number 1, recognized clearly care as a human right in a specific case. And that is going to be echoing at different levels because we have an antecedent in 2020 at the Constitutional Court in Ecuador that also recognized care as a human care. So we have a process of activism which is very important. And so we are talking about very individual cases that are going to be resolved, but it is also potentially going to be opening a scenario in which the judges are going to expand on what they are regulating. It was regulating on a specific case, but maybe they can go to a case that involves collective actors, a community. So that is very important because we should not left it behind. And now regarding the conservator side, there is a different question that we should there's a different question that we should ask ourselves as feminists or those who are not feminists but are involved in care, which is how many women have supported, and in Argentina, it's a very specific case, but have supported some positions, some candidates that go against, not only against care, as Eileen mentioned, that are, disqualifying care and all those involved, but clearly against feminists. And that is a central point. That is a crucial point that does make us think again about those categories. So I think that it is going to be a great debate and it's going to be a great closing. And now I want to give the floor to Flavia Marco Navarro, who's the first speaker. She's a lawyer specialized in law with masters in gender. She's from Bolivia. She's an activist. She's a dear friend, and she has been central in all debates region-wise. I'm not going to say for how many years, but there are many years. And Flavia, who's very clear in her arguments and the background, the empirical background, allowed us to have a gender perspective in the labor field, but also in social security. So it's great to have you, Flavia. You have the floor. Thank you very much, Laura. Good morning to everyone. Thank you very much for your trust, and thank you for to this analytical community that is providing leaving behind a great legacy for our studies and our activism. In 10 minutes, I am going to discuss a topic of each of the session in terms of the summary that was shared with me. I'm going to talk about the first session. It said that we did not discuss enough about care. What does it mean that care is so central to life? And this is important because care is not everything. Those who are here, we know that. We have to have clarity to transmit that idea. Yes, of course, it's central to life. And care to the environment, for example, it's also part of life. But we have to also recognize that this also implies some challenges in terms of the policies that we are imagining and how are we going to include care for the environment. And we cannot leave it behind. We cannot leave it out because there are no young feminists that are not towards caring for the environment. So it is an alliance. I think that we have to include the environment when we talk about feminism. But for me, this means should we have a concept of care in terms of public policies and maybe another concept in terms of philosophy and different concepts? Or should we have some elements in which we reach consensus? And this might be obvious, but it is not, because this was identified in the first session. And there are some concepts, some characteristics that are very concerning. For example, in Colombia, for example, a woman who's part of of a table said that taking care of a family, of a household, is part of care. And I said, well, this is care. Well, then all men are caretakers as well. So minimum agreements. Another thing that happened, I think it was in Central America, that prostitution, for example, prostitution is care. It might seem very extremist, but it is very problematic. I am talking about at the interior of the groups of women. From my perspective, I think that has to do with the concept of care and the essence of the concept of care. And it is especially serious in terms of communication and the strategies in communication. And that is one of the foundations of the debates. So in terms of communication strategies, we need to be very clear on what care is. What does it mean? And this also has to do with the second session, and that came from the case of Argentina, but it is also important outside of Argentina in which it was identified. That is, it is important region-wise, which is there was not a mobilization behind the bills and those projects, and that has to do with a vulnerability. It has to do with the strategies of communication and has to do with the consensus or the lack of consensus in terms of care. And it also has to do with what Laura and Eileen mentioned, which is a lack of a strong citizen participation. Because we see, for example, in some countries that are rich consensus, for example, for during campaigns, or for example, in the Andean countries, they have different names, but they are not strong enough. It is not a citizen demand. It is not even a demand from women. It is still the biggest demand is against abortion and against violence. So in that sense, women have had the capacity of seeing the dependency of reproductive rights, for example, and the right for care. So that should also be taken into account when we are taking this additional step of analyzing the groups of women in particular. And I was trying to link session 1 and session 2. In session 3, there was a topic that has to do with Peru. I think it's something that has to do with other countries, which is what we have right now. And they were talking about some policies, and there is not a system of care. There are institutions that take care of the
Realmente notable que esto, que es un desafío de toda la región sin duda, más en países como Bolivia, salga justamente en el caso costarricense, ¿no? Que uno diría es uno de los países con institucionalidad social de más tradición y más sólida de América Latina. Y que se dé en materia de cuidado, a pesar de que hay una normativa para la red CUDI, ¿no? Cuidado infantil, y hay otra para el sistema de cuidados de personas adultas en situación de dependencia, ¿no? Entonces, en un país con una tradición como Costa Rica, en un país que tiene unas normativas, en un país que tiene una red, se plantea el desafío de gobernanza institucional. Uno dice, ¿qué queda para el resto de América Latina? ¿No? Es efectivamente algo vigente a lo cual creo que hay que seguirle prestando atención, que tiene que ver con capacidades institucionales, que tiene que ver con cultura política en muchos países como el mío, pero que también tiene que ver con enfoques, ¿no? Y esto lo destacaba Laura y Lynn y se destaca en esta sesión 5, que es esta dicotomía entre el acceso universal versus necesidad.
versus the need. And something that is extremely serious, because it's something that comes from women as well, that we see in other women. I have participated in the creation of proposals in different countries, but I am going to be referring to a bill in my country, and we have been working with women groups, and women want to create a filter of the need or the income. They want to create that filter. So it's something that Laura mentioned. Behind the construction of law and raising awareness, and not only the right to care, but in general, care or the rights. And I was reading the sessions of this community on the reaction that many women, many feminists have in terms of some programs. They can be forward or against an income. And that is the same with care, particularly with care services. You can see in feminists, for example, who are working on care issues, that when they are making demands towards the state, they put the filter of need, of the necessity. So it should be free services only for those who need them, and not for everyone. And so there is a contradiction here, and it is very difficult to resolve that contradiction. We have a lot of work to do in this sense. And to close, because I am almost at my 10 minutes, I just want to mention the last session, which is the fourth session. It's something that Mariela mentioned in the case of Cuba. The idea between a national care system that we have been working as feminists and a legal framework that already exists. And in that sense, I would say that the laws and institutions that has to be coherent, but also the plan that already exists, the idea of the organization that already exists. And this is very important beyond the Cuba's case and all the other cases that we have mentioned, because feminists have been working on proposals at a national level based on a specific reference, but that are not necessarily coherent with the planning at a federal state, at a federal level, and at different levels of the government administration. So the feminist proposals are not necessarily aligned with government proposals. I know I'm on time, but I wanted to close by saying that what Eileen mentioned at the beginning is not trivial, that we have focused on constitutions. I think that it is very important, and that is not casual. It is not random, because I think that is something that Latin America can offer to the rest of the communities, because we have an analysis on institutions, and we have been demanding on institutions, and it goes hand in hand with Laura Pautassi. We would say that it is part of international law and human rights, focusing on that, focusing on institutions. And I think that Latin American focus on institutions in the state, in policies, has to do with the interest of care was not based on academic feminism. No, even if we request men to participate, we also demanding it from the government. We require many changes, among them a cultural change. So that is how our analytical community started. It started because we wanted to make demands towards our governments in Latin America. And I think that was very visible in the meeting that we had in Costa Rica, specifically in different sessions, where you could see the amount of presentations that had to do with institutions. So I think that we have to continue working on that with all the people that was mentioned, but also to that we have a lot to offer from Latin America. Thank you very much. Thank you very much, Flavia. It was so clear. It was very succinct. There is a lot of questions. Thank you for linking it with the demand, with social movements, for reminding us how the feminist movement is so different, that there are some consolidated feminisms, that there are very young feminists, and all of those questions that we shared in our agenda. Now, I would like to give the floor to the second speaker today, and we are so interested in hearing from her because she has quite an impressive trajectory in the civil society. I'm talking about Emilienne de León. She's technical secretary of the Global Alliance for Care, and with whom we have organized this analytical community. Emilienne, you have the floor. Thank you. Thank you very much, Laura. And thank you to Elisa, of course, because she promoted this second season of the analytical community. And I am thinking of what you mentioned, Laura. Hopefully there will be a third season. I think that we need a third or even fourth if the Global Alliance for Care can create those spaces so that we can continue making some advancements towards care. I think that we will be achieving some of our objectives. Thank you, Laura Pautassi, and Eileen Torres, and Ala Frederick Everett Foundation, and all of the women and organizations that were part of this very important analytical community that is closing today with fundamental questions on what has been discussed throughout these months. I would like to thank to Flavia Marco Navarro. Thank you for your thoughts. I agree with them. And at the end of my intervention, I think there is something that we are going to be sharing in our conclusion. As a Global Alliance for Care, it's so great to continue promoting these sort of spaces in which we are sharing experiences and sharing lessons learned. And I think that it is especially important in the sense of the lessons learned in institutions at an national level, but also as a local level. And in terms of policies, I think that it has been fundamental to enriching the conversation. From the Alliance, we recognize the right to care as a human right at an international level. It means also the idea of the right to receive care, to take care, and self-care. And that is a construction towards a new organization of care and a new pact at a worldwide. It is not necessarily economic pact, but the care between people, and of course, taking care of the planet, because without the world, we cannot live and continue to survive. I agree that not all care, but yes, care towards the environment. I do believe that it is a fundamental and an essential space because women are really focused on that, and they are developing a lot of work. And making a lot of progress towards it. So when we're talking about the right and the human rights, it's not only central towards the necessities that we need towards people and the state, but also the responsibilities towards the state responsibilities to provide those services and making those rights universal. And we can continue to discuss of the priority groups. Yes, all people require those services. All people have the right to care, not only some people. In the right to care has been recognized as part of the instruments that are a right, for example, towards children, towards the elderly, and those with disabilities. But it has been compartmentalized. And I think that is something that we should discuss in the following meeting, how those systems of care at a national level or local level are not in contradiction with current policies, but those interpreters of this, not only of the laws, but also the feminists at the same time. So it is a human right. And so because the care agenda cannot leave behind people that are taking care, that is care providers. So we should discuss the rights of care providers as well. So I know that there is a lot of responsibility of this, especially for unpaid care, that is very unfair, that it is on the shoulders of women and children and women and girls, and that is unfair because it has not fallen on the shoulders of men and boys. So that if we did that, if we made a change, it would mean a change in our community. And that is why this framework in terms of concepts, which has been discussed, but the 3 R's that has to do with compensation, with the distribution, among other things. And it has to be an autonomous effort and interdependent. It has to do with the social health, with the healthcare and care and work. And Laura Pautassi, for example, has recognized the opportunity of consulting the citizens, and this with the effort, I'm talking about the effort that Argentina did with the Inter-American Court of Human Rights. And so between the Inter-American Court of Social Security, we provided a project to position human to care and human and the right to care and the right to social protection. And we did that with the help of Flavia. Thank you very much, Flavia. At the same time, we contributed as an alliance, and we supported with the Latin American group of justice and gender that advocated towards care in a general way. But beyond those institutions and those efforts, the effective action towards care has to translate in concrete public policies in the countries, because we may have services which exist. For example, we have maps, we have care maps, but those are not linked to the law, the legal framework, and the right to care. And that is something that we should continue to work on. There are still gaps. There is a will of the current government to create those services. And if there is a citizen demand, then they will continue with that. But that is not linked to law, to specific laws. And that allows the governments to disappear those services at any time. And there was some case studies. We analyzed the advances, the obstacles, resistances, the gaps that are in the recognition of care in Latin America. And I do believe that Latin America is a pioneer worldwide, not only in the South, in Africa or Asia, where the topic of care is just gaining strength. The governments are beginning to include it. Not only that, but in some of the policies, and also in terms of European systems of care that are linked to men as the central factor of the main worker and the workforce, and not taking into account the evolution of women as workers as well. So along of these sessions, we have shared a lot of initiatives, programs, etc., that will allow us to achieve this right in different contexts, in laws, in public policies, etc. We know that in Latin America, as I was mentioned, the focus on institutions has provided a lot of strength in the in the services of care. And this has been, the perspectives have been very different. We are talking about jobs that are paid and unpaid, and also the need of those who require support and care. And this is providing us with a very specific landscape. Some governments are promoting this agenda, and this despite the existing challenges. For example, the challenge in articulating the different efforts from the government and different issues or topics of gender, etc. So when we are all fragmented, all our services are fragmented, then integrating all of those services in a central service is very difficult. And I think that there is a lot of red tape as well. There is a lot of bureaucracy. And so there is the challenge of making it central, of making it more a joint effort. I think it's one of the obstacles that we are facing in Latin America.
Tenemos un gran desafío actualmente en América
We have
Latina.
a lot of challenges in Latin America, not only to continue to making progress towards societies where care is part of it, but also including other communities. For example, in Argentina, Laura has mentioned that 10 days ago, we continued to be extremely sad because of the situation in Argentina. But what does it imply since the last presidential election? Well, those challenges are only the beginning of the agenda, and we have to continue working towards that agenda. And I want to say that a couple of months ago, I was in Bogotá in a preparatory meeting, a regional meeting, because of a general a conference. And in that sense, I had the opportunity of reading the job that Claudia López Sobre is working on, her project, but also I also heard from the Montevideo major on how to sustain that work. And there was a question from the public, but how can we continue to work on the objectives and continue to work towards the objectives that we have achieved? And she said, I am a leftist woman. I have been working in my country for 40 years, and it is so hard to build equal situations in our communities. And once we achieve that equality, when we achieve actual change, the next government can destroy all the government, all the work that we have done. What we can do is that we can continue to work towards that dream, continue to work toward that movement. And I think that as feminists, we have to continue to do that. Our resilience and the capacity to continue the work and continue helping our colleagues in Latin America. And I want to end by saying that I understand that in the analysis that we did, that there is not a lot of participation from the citizens that move, that make changes, and not only from feminism. So the challenge is the challenge should be to give it more representation, to represent care providers, to represent care recipients, because I think that they will make the change, they will take action. And I know that it is not going to be an easy effort because there is a lot of fragmentation, and because the employer is not so defined in terms of care, but still there are organizations and unions that can be the central access to organize that mobilization. I think that there has to be higher participation from citizens, but that will imply a cultural change. And I think that we can focus on the care providers, that is to involving the care providers and organizations of care providers, and to look for alliances, to seek alliances at a regional and global level, so that the care agenda is supported and maintained. And I just wanted to finish up with that. I wanted to say that the Global Alliance for Care continues to offer this space where we can all think and make progress towards the right to care, as well as other topics and issues that are aligned, are related to it. And if we need one or more meetings, that's what we will continue to do. Thank you very much for the work that you have done in all of these sessions. Thank you very much, Emilienne. It was an excellent presentation. The topics that you also mentioned were so rich. I think that the work of the Alliance is so important. And the experience, of course, of building it from the community, the different perspectives are essential. I am not a great moderator as Elisa, but we have the opportunity of hearing your questions, hearing your interventions, your reactions before closing at the time that we decided to finish. So if there are any questions, any comments from the speakers, go ahead, just raise your hands. Alba, go ahead. It was extraordinary, both the summary by Eileen and Laura, as well as the comments from Flavia and Emilienne. They really were very enriching. I wanted to highlight something that I thought was very important. So I thought that the question was, where are we coming from? I think that there is a knot, that there is a problem. There are some problems that are priority. Well, the problem and the tension between universality and priority groups. And also that has to do with what Flavia was mentioning, that inside feminist groups, there are very different perspectives, a lot of perspectives. For example, prioritizing conditional transfers, for example, and at one point, that is the representation of the tension that I mean, the universalization versus priority groups. So it is a tension that is made evident inside feminist groups, but I think that it's present in public policies as well, in general. And what we are seeing, that terrible event that took place in Argentina, was an example of that tension. There is a very strong tension between what is considered a right, a need, and at which point we are prioritizing some, and at what point that prioritization has been transparent or not, has it been fair or not. Some are questioning that they are prioritizing some groups, and actually they are asking if those rights are correct. So I think that that issue, that problem, can be expressed in many different ways. It can be expressed in care, of course, but it has a lot of branches at a social level. In general, in terms of public policy. Okay, so that's one thing. The second thing, the second topic, which at least caught my attention during this summary, which was extremely interesting, and the comments that were also very interesting, was the terms of social mobilization. I'm talking about at what point this care agenda can help social mobilization, especially in specific circumstances. You know, the anti-right groups in Latin America are strong right now. In some countries, we are seeing it very clearly. In other countries, not as clearly. For example, they are not as evident, but the anti-rights movements are existing, and they are in all Latin America. And we know, and I say Latin America because it's where we are focusing, it's the region, but it's not exclusive Latin America. We can see it in Europe, we can see it in the United States. And there are some rights. For example, there are some rights that are very important for feminists. For example, abortion. It's a very important topic, but there are other topics as well. So as you can see, this has to do with the first problem. But yes, we have to talk about the theory, and the other thing is more of a practical matter. But actually, those are two faces of the same coin. And I do feel, I don't know how to say it. I'm going to, I will try to say it. Maybe it's not going to be the best way, but it has to do with the moral behind working on this. The reasons why we're working on this. We have to be able to think conceptually and translate that in a specific strategies. But because the truth is that the reactions of anti-rights movements are very strong. Personally, I believe that one of the explanations that Laura provided, which was very, very painful to me, is when you said, yes, it's true. Yes, many women voted for Milei because it's impossible that Milei could have won without women. So there is a lot, I mean, we are going backwards in terms of rights. And maybe because they were angry, but I do say that defending a traditional family is something that is gaining strength in Latin America. And women have been colonized with that idea because we are, the owners or the protectors of the traditional family, and the traditional family is protecting us. So that is the knot, that is the problem. That is the issue here, which is something important as well that we should take into account. Very well, thank you.
Muchas gracias, querida Alba.
Thank
Siempre
you,
con
dear
una
Alba.
perspectiva también desde Venezuela,
You always
muy,
have a
muy
great
importante.
perspective from
Sigue
Venezuela,
la
which is very
primera palabra
important.
René.
Then, René Lopez, you have the floor. Go ahead, René. Well, first, it is a pleasure to hear the very rich analysis from the community and at different sessions, and the idea of having this maybe but potentially third season, which I am very excited for. I think that it is necessary to continue this debate and to continue talking about what do we mean by care when we say care, and what was mentioned here as well. The growth of rights movements, and we should understand what we are doing and what is the alternative that we should offer. And in that sense, something that I see in the right movements is a coherence in all of the expressions of the right groups. And we need an agenda that unites us, because we should, yes, of course, focus on demands, but those are per sector, and we are not very clear on how we are going to do it actually in real terms. And I think that the discussion of care as life sustenance implies a lot of agendas that many feminist groups have that focus on the environment. And so my contribution is how can we have a political will that includes and collects different agendas that and achieve that gender equality that we are all looking for. So it would be helpful to have those debates and go deeper on those topics and go deeper on what we understand care to be, so that we can have a unified agenda. Thank you very much, René. Now Anaís has the floor. Good morning, everyone. I want to say thank you for the work done in the last years. I do believe that there is an archive of knowledge that has been produced in the region. I am from Venezuela, and I want to talk about the tensions that are happening. There is a tensions between feminisms, for example. I feel it in myself that it can be protected and that it can be a voice in the academia in different areas, but that has no capacity of concrete actions. For example, how can we make care to be thought of as a right that can mobilize women? And for example, the terms of violence and abortion, it's not something that has to do with feminists alone. For example, in Venezuela, we have not been able to make it a massive movement with women in the country. And so I think that does mean that we ask ourselves, what is the relationship between feminism and political agenda beyond being activists or counselors? I think that that is the question, and that is for all of you. What is the relationship between the two of those? And I think that the progressive country governments in Latin America have a lot of responsibility in terms of how they are understanding it, and understanding and implementing these agendas and what they can do to transform the lives of women and their families. So I do believe that there is an important debate that we have to face, which is how are we going to be recovering feminism and a movement that can create real policies as activists and as women who are providing that counselor and specifically in the case of Venezuela, but in other cases. Thank you very much, because it has been such an incredible work that you have been doing. Thank you very much, Anais. Yes, it was a collective work. Any other intervention? Yeah, Nieves Rico, go ahead. Thank you very much. Can you hear me? Yes, we can hear you very well. Thank you very much, Eileen, Laura, Flavia, Emilienne. Thank you for your contribution. I learned a lot. Thank you very much. I want to say two things. I thought many things, but I want to focus on two things. And one has to do with how right to care in public policies challenges feminist movement, the movement from women, and those different movements that are working toward freedom. And I think that we have a lot of work cut out for us. I was thinking, how are we going to be bringing to the table a lot of leaders, not from the academia necessarily, not as counselors, as it was mentioned at different levels, but even when we are talking about community and care in the community and the work being done there, because I think that feminists is still in the should do in terms of care and the operations of this right. In terms with other legitimate concerns, which are very important and crucial, which feminisms in Latin America have been facing. So that is one of the things that I wanted to mention. I was thinking, how is it possible that if we have new versions of this community, how can they be integrated, or we can come together and maybe we can have some representation from activists or feminist movements or national movements or regional movements in Latin America and the Caribbean, and maybe we can include them in our dialogues and we can have an impact and try to move together. And the other thing is that, as Laura has mentioned at many times, that public policies are a way of taking action towards care. I think that what Flavia mentioned as well in terms of the architecture, governance, the systems and networks of care linked as well to institutions and the guidelines of those systems, the networks of care and leaderships inside of the state. That is another arena, that is another thought process that still has a lot to be analyzed, because we have state architectures that are fragmented, that are with different competencies in terms of populations, but also between the different services and the services and the resources in the territories. So we also have to talk about the state architecture, governance, and the guidelines. I think that is something that we have to discuss still. Thank you.
Muchísimas gracias,
Thank
Nieves.
you very
Un
much,
placer poder
Nieves.
contar contigo
It
en
was a
en esta
pleasure
comunidad
to
como
have you
testigo.
here in this community
No sé si
as
hay
a
alguien más
participator.
que
I don't know if someone else wants to take the floor.
termino de ver manos levantadas. Cualquier
I
cosa
don't
pueden
see any
abrir
more
micrófono.
hands, but if someone wants to speak, please
Si
open
no,
your mics.
agradecerles la atención. Ya se
Otherwise,
presenta
thank you very
nuestra
much.
queridísima
Our
Elisa,
dear Elisa is
a quien
here
le
at
voy
last.
a trasladar la
I
palabra,
am going to give the floor to
porque si
her
no, como dijimos al
because,
inicio, sin
as we
Elisa
said at
esta
the beginning,
comunidad
without
no
Elisa,
era
this
posible. Así
community
que,
would not
Elisa, un
be here.
placer.
So,
Una
Elisa,
pena que
it's
tuviste
a
que
pleasure to have
soltar
you
una
here.
agenda, pero has
I am
estado
sorry that
presente en esta
your
reunión, así que
agenda was
volvemos a ti.
so
Gracias,
full,
Elisa.
but thank you for being here.
Antes de que hable Elisa,
Before
esta es
Elisa,
mi bebé.
go ahead.
Ella
This is my
entró a la
baby.
comunidad
My
hace
baby
poquito
has
y esta
been
es la misma
part
ciudad.
of the community.
Nuestra segunda temporada de la comunidad de
This is
análisis
part of the
y ya
second
está
season of the analytical
esto que
community, and he has
organizando
been
o
here
completa
in all our meetings
o cerca.
in different modalities,
Así que
close
muchísimas
by
gracias.
or, breastfeeding in different modalities. The baby has participated. Congratulations.
Gracias a Julián, que
Thank
efectivamente
you,
está en esta
Julian, who
comunidad,
has
y gracias a
also been
Eileen,
in the
que la verdad
community.
ha hecho
And
también un
thank you,
esfuerzo por
Eileen.
estar
Thank you for
logrando
doing
conciliar
that effort, because I
estas dos
know it's
actividades.
difficult
Pues
to
a mí no me queda
do
más que
both things at the
reconocer
same time. I just
todas el
wanted to
interés,
thank you
a Alianza
for your
como
interest.
resultados
Thank you to the Global
y
Alliance for
honestamente
Care.
Emilienne,
Thank you,
hicimos
Emilienne.
nuestra
We have
primera
thought and
edición, la
designed the
primera versión
first
de la
edition, the
comunidad
first version of
el
the
año pasado.
community.
Y
Last
está
year we did
resultando
it,
muy bien, Emilienne.
and
No sé
it
si
has
por
worked,
ahí el
Emilienne.
equipo ya te
I don't
compartió
know
la
if your
invitación. Everton me
team
permitía hacer
mentioned
como
this,
pequeña
but the
digamos,
foundation,
de lo que
Friedrich
hacemos
Hebert,
en coliderazgo con ustedes.
with
Hacemos
your
esta
leadership,
comunidad que
we
obviamente
decided to
podemos
create
tener
this
con su
community
apoyo
that,
de la
of
alianza,
course,
de todas
can be
las participantes acá,
can be
significadores
part of
y
the
sobre todo
alliance
para
if
las
you can do
comunidades
something
que
with it,
vengan,
especially for the
no
communities
solo
that
las
are
que
coming,
podamos seguir
not
o
only
estemos
the
sosteniendo
ones
desde la
that can
Fundación Everett,
continue
sino también
working
todas
from the
aquellas
Everett
varias
Foundation. I know that there are a lot of
decirles a
proposals,
raíz de este
and
grupo
I
de
want to
trabajo
say
hicimos
that
esta pequeña guía
from this work,
y
we created a guide,
comentarles
a small
que
guide, and
creo
saying
que
that
un
I do
ancla
believe
del
that
éxito de esta comunidad
the
es que
key
pues
to the
tuvimos
success of this
alianza con
community
Laura Pautassi
is
y
because we
nosotros
worked with
estuvimos
Laura
completamente
Pautassi and
de
Aline
manera frontal
Torres, with
y creo
Julian,
que
of
eso
course.
fue clave.
And
Yo
I
les
think that was
agradecí
key.
mucho a Laura
I
y a
thank
Aline
them
porque
very
hicimos
much.
hoy el
Thank you,
protocolo de
Claudia. Thank you,
participación.
Eileen, for the
Y como
time,
bien dice
for your
Emilienne,
time and your
pues
effort. And
tenemos
as
el
Anais
acervo,
said,
ustedes saben,
we
ustedes
have,
tienen
the
el acceso al
database.
drive, donde está todo el
You have
material que
access to the
ustedes
drive.
tuvieron uno o
There is
dos
all
reuniones
of the
y así
information
como la
of
primera
the first
temporada
season
la
and the second
cerramos con
season.
la
And as it
publicación de
was
Laura
the first
Pautassi
season,
con derecho a
we are
cuidado.
going to be closing
Esta
with the right
segunda
to
no
care
sé
of
si
Laura
por
Bautasi. And I
comunicación
think this
también,
second
yo espero que en
season,
marzo
I don't know if someone mentioned it, but I hope that
nosotros lo
by
que queremos
March
provocar es
2024,
que tu
we
informe
want to publish a
con la
report
información de este año.
with
La verdad es que
the
suena muy
information
bien,
of what
pues
took
hace
place
2
this
años
year.
no nos
I know that it's
imaginábamos que íbamos
agenda
a estar
that
en
could
este
not have been
punto
foreseen. We
y
did not
pues
imagine
por lo
ourselves
que
being at
se
this
escucha,
point.
yo también
And
convencida y
what I
vocera
hear,
de
I
esta
am
agenda,
convinced, and I am, a spokesperson from
los
this
miembros
agenda.
de la alianza
There
pues
continue
eso,
to be a lot
seguir
of topics that
reuniéndonos,
need to be
seguir
discussed, but
discutiendo,
hopefully they
revisando,
will continue to
actualizándonos,
meet each
a veces
other, that we
tenemos
can continue to
espacio,
discuss
pero
this,
siempre
we
nos
can
quedamos tres y ahí vamos otra
advance
vez
10
y creo que
steps,
esto
and
es
then we
todo,
can go back
vamos
a
a
little
seguir
bit. And
resistiendo
it's
y
just
seguir
part of the
sosteniéndonos
process, but
entre
it's
todas
part
y la
of
verdad
the
es que
process
fue un
also
placer y
resisting.
les
And it
agradezco.
was been a pleasure. Thank you very
Ahí
much for
está
all
el
of it.
acceso al drive.
and the access to the drive is there. The link to the drive is there. And through the Alliance, we are going to be updating you on when that report will be coming. And we are going to be discussing the conversation that we've had. Well, it's not a goodbye. Thank you, Emilienne. Thank you, Flavia. It's just see you soon. So thank you very much. And we will keep in contact. Thank you, Elisa. Can I just make a couple of announcements? Yes, of course. First, we are organizing an analytical community in terms of investment in cares, in system cares, and all those policies, anything that has to do with budgets and investment from the state. And the leader of that, as in this case, it was the Friedrich Ebert Foundation, and in the other case is Oxfam. And so we are going to be sharing more information as soon as we have it, because I think that it relates to what we are discussing here. And the second is that we have launched the platform, the digital platform of the Alliance, which at this moment, it's an archive and a collection of anything related to care. So I invite you to see the website, send your publications of what came out from the first community. It's at the top. And the report that it will be coming is going to be uploaded, but also your extraordinary work if you want to share it. And this is just towards expanding the learning of each of the members and the newcomers, new participants that potentially could be joining. So the website is already on the chat. You can see our website. This is our digital community, our global digital community. And Elisa, we are ready. And if you want to organize a third community, analytical community, we welcome it, of course. As you know, I am interim technical secretary. The last one left in July, and we are selecting a new secretary. Hopefully, by January, she will take her position and we will introduce her, of course, but I just want to say that I am going to be continue working behind scenes, but we will have a new secretary. Yes. I don't know if the Global Alliance for Care can also include the email for those who want to send some documents to the global digital community. Some of the publications of the Evert Foundation is there, and it's a great platform. So if you want, you can copy and paste the email so that we can send that information. And they were reminding me that it's Christmas, so I just want to wish you a happy Christmas, a happy New Year. I'm so happy that we are here. We deserve the vacations, hugs and kisses to everyone, and we will continue talking. Thank you very much, Elisa. Thank you, everyone. Thank you so much, everyone.